Hi everyone, I'm Dr. Tai, consultant ophthalmologist and oculoplastic surgeon. Today, I'm going to talk to you about eyelid tumor. Eyelid tumor is an abnormal growth of tissue found on the eyelids or of the structure adjacent to the eye. They are mostly benign, which means harmless and there's nothing to worry about, but they can also be a sign of skin cancer. This growth may be benign, precancerous or cancerous. Basal cell carcinoma is the most common skin cancer of the eyelids. Other types include sebaceous gland carcinoma, squamous cell carcinoma, melanoma, and lymphoma. A history of presumed recurrent chalazion or chronic blepharitis on one side only should always be raised suspicions that a tumor is mimicking these conditions. Benign growths such as simple cysts, nevus, styes, and chalazion may occur. What are the causes of eyelid tumor? Too much sunlight and ultraviolet radiation exposure is a significant risk factor for developing skin cancer of the eyelid. Other factors include fair skin, patients on immunosuppression treatment, family history of skin cancer, and history of arsenic poisoning. In most cases, the exact cause of a tumor is not known. What are the symptoms of eyelid tumor? In many cases, there may be no symptoms of eyelid cancer. The symptoms vary according to the locations and the nature of the tumor. It may present at visible growth on the eyelids, or a local swelling, or just an area of irregularity or loss of eyelashes. To some cases, they may feel pain, notice ulcer, discharge, or bleeding at the area. For tumor occurring on the inner surface of the eyelid or within the eye socket, we call it orbit, the symptom may not be so apparent. They can present in many different ways, with symptoms includes pain, swelling, blurring vision, double vision, or displacement of the eye, either forwards or to one side. How to diagnose eyelid tumor? The diagnosis of an eyelid tumor is best began with careful clinical examination by an oculoplastic surgeon who has special training in eyelid cancer and lid lesion. Often, these eyelid lesions will be photographed for further evaluations and documentations. A biopsy is necessary to determine the nature of the eyelid tumor, and treatment often depends on the result of the biopsy. What is the treatment of eyelid tumor? The management of eyelid tumor depends on the many factors such as age and the general health of the patients, the nature and the location of the tumor, and whether there could be local or peripheral spread of the tumor. Some benign tumors do not require any treatment. Other tumors may need surgical intervention, medical treatments, chemotherapy, or even radiotherapy. Eyelid tumors are generally managed with a complete excision and subsequently reconstructive surgery. The reconstructive surgery is usually performed on the same day or on the day after the tumor has been removed. Depends on the time it may take for the histopathologist to confirm that the tumor has been completely removed. Some tumors may be managed with local freezing, we call it cryotherapy, irradiations, or medical treatments which stimulates the immune system to destroy the abnormal tumor cell. The prognosis of eyelid tumor is generally quite good if they have been evaluated and treated early. If left untreated, the lesion can grow and can infiltrate and erode the eye and its surrounding structure, as well as spread to other parts of the body. In that case, complete excision can result in larger defect and often even loss of eye in the rare cases. These need more extensive reconstructive surgery with a greater risk to overall protection of eye. If you have any growth or swelling on your eyelids or around the eye, do remember to schedule an examination with your doctor.